Who is a good candidate for penile implant? Obviously, penile implant surgery is not meant for everybody who walks into a urologist's office with erectile dysfunction. However, bear in mind that most of the other treatment that we have, in other words, the pills such as Viagra, Cialis, and others, as well as even the injections, are not as effective. So therefore, most of these patients, or a vast majority of them, end up failing that treatment, and then they become candidates for the best option available, which is the penile implant. Penile implant surgery is covered by most insurance that I know. Medicare does cover penile implants procedures, and private insurances do as well. Although in those instances, we do have to have prior authorization before proceeding. There are two main types of penile implants available here in the United States. The first one, which is the one I almost never use, is called the malleable. That is a fairly rigid one to begin with, that you do not pump it up or down, so it stays in the same state almost always. Then the second one, which is the more popular one, is the inflatable penile prosthesis, which is the one you actually have full control of inflating it to an erect position, whereby you can use it to your satisfaction, and then you deflate it or pump it down after you've finished using it. The difference between the two is that the malleable one is a rigid implant. In other words, it stays rigid most of the time. When you are ready to use it, you push it up, and then when you are done using it, you push it down. There's no pumping mechanism to pump it full or not. The other one, which is the inflatable, or the more popular one, has three parts. One is a reservoir that contains fluid, and there's a pump which stays in the scrotum, and when you pump it up, the fluid is transferred from the reservoir into the cylinders themselves, which gets erect. And as long as it's erect, you can use it as long as you want. Once you're done, you can also press a little button on the side of the pump, which transfers the fluid out of the cylinder into the reservoir. So this type of implant is as physiologically similar to your natural erection as possible, and that is the more popular one and also the most effective one. Patients come to me all the time asking that by putting an implant, can we make their penis bigger? I generally tell them that what you see is what you get. Now, having said that, let me modify that a little bit. Because as erectile dysfunction progresses, the penis gets shorter. So a lot of these patients will come in thinking that knowing that their penis is shorter, excuse me, and then they want to get their penis larger and longer, as perhaps when they were teenagers. Now, the inflatable penile prosthesis is the one which will give you the maximum length and girth possible. There's no other implant that does that. The Coloplast inflatable penile prosthesis does that. But we do size your penis, and then we will tell you in advance what you're gonna get, because we're gonna stretch your penis as maximally possible, and also we're gonna give you the one that gives you as big a girth as possible. Operating the penile implant device is pretty simple actually. The device comes in three components. One is called the cylinder, or the cylinders, which is two of them, which goes into the penis itself. There's a reservoir which goes in your abdominal cavity next to the bladder most of the time, and that contains fluid. And then there's a pump mechanism which we place inside the scrotum. Now, to operate the device, you pump it up, you feel the pump inside the scrotum, and you squeeze it a few times, and that process transfers fluid from the reservoir into the cylinder. And as that happens, the cylinder gets wider and longer until it's fully erect. Now, once you finish using it, you want to deflate it. And the operation that you need to bring penis back down is a little button on the side of the pump that you squeeze one time. As you squeeze it, you also squeeze the penis at the same time, and that transfers the fluid out of the penis and back into the reservoir where it stays, and that brings the penis down. So really, the operation of the device is quite straightforward. Simply yes. It does not change because the process of erection does not involve ejaculation. That's a separate pathway. So you're going to ejaculate the same way. The sensation is going to be the same. So yes. The implant is totally concealed. That's a good thing. So as I said earlier, if you see someone with an implant and they don't tell you that they have an implant, you would not know. The anatomy looks the same. There's nothing on the outside. Everything is completely concealed on the inside. The penile implant is made up of a special material called Bioflex. Bioflex was developed specifically for this penile implant because it has special properties. One of them being that it withstands all that pressure that may be put on the implant as it resides in your penis and the body. It also has the capability to give you the maximum girth, as I mentioned earlier, and so you're going to get a very, very good erection when you're using. The solution inside the implant is saline or salt water, so it's not toxic to the body. Even if it leaks out, which almost never happens, it's not going to be a problem. It gets into the body just like salt water. The body will absorb it. So it's a very, very safe solution that we have in the implant. Okay, so there are different approaches that different surgeons use to put in the penile implant. The one I use is called the infrapubic approach. Just a small incision, about 3 centimeters, just above the pubic bone, and then once that incision is made, we dissect down until we feel the corporal bodies, which is the erectile bodies themselves, and through that single incision we are able to place the implant, the cylinders in the penis, place the reservoir next to the bladder, and also place the pump device, which is this one here. This is the pump. I don't know if you can see it well. I'm just trying to pump it up, and this is how you use it to bring it down. It may not be that clear, but anyway, that's how we put in through that single incision. We're able to put in all the 3 components of the device. Okay, recovery. First of all, this is an outpatient surgery. Patients are not kept in the hospital as it was done back in the day. So you come in on the morning of the procedure, they get you ready, and we take you to surgery to have your surgery done. Once the surgery is done, you spend a couple hours in the recovery room, and then you go home. Now, it's important that when you go home, you take it easy. You do not use the device until you come for a follow-up visit. You're going to have a drain placed inside the scrotum that we have to remove 2 to 3 days after the surgery. So you come back to your office, get the drain removed, and then you go back home. And then 2 weeks after that, you come to the office and we teach you how to pump the device up and down. And then you go home and you start practicing on your own. Roughly, you will be advised not to try to have intercourse with the device for about 4 weeks on the average. That's, depend on which surgeon. Some surgeons 3 weeks, some 5 weeks, some 6 weeks. But in my case, most patients are able to use it 4 weeks after the surgery. One can use the device roughly 4 weeks after it is put in. Sometimes it may take a little bit longer, especially in diabetics, for example, because they take a little longer to heal. But generally speaking, anywhere from 3 to 6 weeks, with 4 weeks being the average time, after which one can start using the device. Studies have revealed that approximately 60% of all the implants will last 15 years or longer. The satisfaction rates among men who have had a penile implant is about 95%, 95 to 98% actually. In terms of potential risks of penile prosthesis, the one that keeps most implanters up at night is infection. Fortunately, the rate of infection after penile prosthesis is very low, as low as 1%. So the patient that I counsel before implant have to be willing to adhere to the instructions that we give them, to be very careful. Obviously, we keep them on antibiotics pre and post-op in attempts to prevent these potential infections. Another thing that can happen is because this is a mechanical device, you can have some mechanical problems. One of them, which is extrusion of the implant, whereby the implant protrudes out of the end of the penis. It's a very, very rare scenario, but that can also happen, especially those who have who have had implant much longer and are not active. So those things can happen. So again, you have to be willing to come back to be evaluated from time to time, especially in the initial phases after the implant surgery.